Dominicanos en el Capitolio, en vivo por TV Quisqueya.
So many ways by the extremism coming from the other side of the aisle, who've enacted the largest cut to Medicaid in American history, who are, as a result of their policies, forcing hospitals and nursing homes and community-based health centers to close, who have refused over in the Senate to extend the Affordable Care Act tax credits, which means tens of millions of Americans now at risk of having their health insurance premiums skyrocket, in some cases to $1,000 or $2,000 per month. That is not acceptable in the United States of America. We believe and will fight to protect Medicaid, we'll fight to protect the Affordable Care Act, fight to protect our hospitals, fight to protect our nursing homes, fight to protect our community-based health clinics, fight to protect the Affordable Care Act tax credits, and fight for the principle that here in America, health care can't simply be a privilege available only to the wealthy, the well-off, and the well-connected. Health care is a right available to every single community, and we're going to make sure we bring that to life for the Dominican American community and for all Americans. And lastly, of course, we will continue, led by Adriano, to deal with the situation with respect to immigration enforcement that is completely and totally out of control. We believe that taxpayer dollars, your taxpayer dollars, should be used to make your life more affordable, not to target or brutalize or in some cases kill American citizens like Renee Nicole Good or Alex Preddy, or violently target law-abiding immigrant families all across the country who have contributed in so many incredible ways. ICE is out of control, the American people know it, and they need to be reined in. Because immigration enforcement in this country should be fair, it should be just, and it should be humane. And that's not what's taking place right now. And so our promise to you is that unless there are dramatic reforms to the way in which ICE and DHS are conducting themselves, that the DHS funding bill should not move forward. Period. Full stop. Because we are, yes, both a nation of laws and a nation of immigrants. A gorgeous mosaic of people who have come from all over the world, including the Dominican Republic, who strengthened this country. Your values are our values are your values. And we're going to fight for this country, fight to make it the best version of herself, fight to lift up our immigrant heritage, fight for the principle of liberty and justice for all. And one day soon, we promise that we're going to end this national nightmare here in America right now and continue this country's march toward a more perfect union. And right at the center of that journey will be the Dominican American community. God bless each and every one of you. God bless the United States of America. Have a wonderful, wonderful conference.
Bien, gracias al líder Hakeem Jeffries de Brooklyn. También yo creo que es prudente, yo quiero mandarle un mensaje a nuestros hermanos dominicanos en República Dominicana, ¿verdad? Donde desafortunadamente yo creo que hay entre algunos, no, yo diría la minoría, pero algunos, un romance tóxico con el presidente de los Estados Unidos. Y todos sabemos que los romances tóxicos no terminan bien. No terminan bien. Entonces, si él impone aranceles injustos al país, no es nuestro amigo. Si golpea a la diáspora, quitándole su seguro de salud a los envejecientes, no es nuestro amigo. Si deporta familia, como yo lo he visto, he sido testigo ocular en los centros de detenciones de madres y padres trabajadoras y trabajadores que nunca han violentado la ley y se ven hoy camino a ser deportados, tampoco es nuestro amigo. Entonces dejen ese romance tóxico que no le va a ir bien. La próxima oradora es una persona ícona aquí en Washington y yo me atrevo a decir en el mundo. Primero porque fue la primera mujer líder del Congreso aquí como representante por el Estado de California de la Cámara de Representantes. Segundo, porque su liderazgo no tiene precedente. Ella este año se retira del Congreso. She retires from Congress this year. Pero ella no ha perdido uno de estos eventos. Estuvo en el primero, en un salón pequeñito, en un edificio administrativo. Y yo creo que existe un afecto natural entre usted y ella. Para mí, Fruta, yo creo que esto va a subir la libra. Para mí es un privilegio presentarle a mamá. Llegó mamá, Nancy Pelosi, nuestra líder de... You never miss one.
I never miss one. Thank you all very much. It's an honor to be with you. Your distinguished representative in Congress, the first Dominican Republican American to be in Congress. He's the first, and he's making up for a lot of lost time by doing so many good things. And one of the good things that he is doing is bringing all of you together. And he just reminded me, which I knew, but reminded me again, that I've never missed one of your meetings, this being the 8th meeting that you've been here, and that's all since he has been in Congress. I want you to know that the congressman has been recognized by our colleagues as a member of the Appropriations Committee, which is a big and competitive, coveted position to have, and there he has an amplified voice on your behalf on issues that relate to the kitchen table issues of our families, to the relationship with the United States and the Dominican Republic, by bringing so many people here so that we understand more clearly from your perspective domestically, from their perspective internationally, what good friends we are. I am honored to follow our distinguished leader, who will soon be the Speaker of the House in another 8 months. But I'm not here to talk politics. I'm here to talk about all of you. You come at a time that is a very difficult one for our nation. Because, and I'm going to quote a Republican president. Are you ready for that? His name was Ronald Reagan. Ronald Reagan said, "This is the last speech I will make as President of the United States." Now, those of you who could remember then or were around then know that he was the great communicator. He was called that. And he said, "This is the last speech I will make as president." So everybody listened. And I want to communicate, he said, a message to the country I love. And he talked about the Statue of Liberty. And he talked about how the Statue of Liberty is a beacon of hope, calling people to our country. And he talked about the fact that America is preeminent in the world because our door is open, and that our country is invigorated by newcomers to our country with their entrepreneurship, enthusiasm, and all the rest. And we will cease to be preeminent in the world if we close that door. how different it is from that Republican president and the president who followed him, George Herbert Walker Bush, who followed that policy leadership as well. We have to know that we are a nation of immigrants. My parents, grandparents, Italian American, here you come with your beautiful pride in your heritage, but deeply patriotic Americans as well. We learn from you, we learn so much from you about not only your culture, but your impact on our country. When I meet with many of newcomers to our country, whatever their background, they spend a good deal of time talking about entrepreneurship. Of course, education and immigration, but entrepreneurship. So thank you for being a vital part of our economy, as well as the enthusiasm for and patriotism for our nation. And then I also want to say that you, let me just say this one thing. Sunday I was at the Super Bowl, and we saw Bad Bunny perform, and it was so remarkable. It was so remarkable. At the end of his performance, he said, "God bless America." And then he shouted out every country in the Americas, including, of course, the Dominican Republic. We are all Americans. And it was a beautiful, beautiful thing. So again, I thank the organizers who've been doing such a great job bringing it all together. This is remarkable. This is not usual. When groups come, we don't have the balconies filled. They don't even know there's a balcony. So this is quite a turnout. And so I'm here to thank you for your patriotism. You're coming to Washington at the invitation of the organizers and under the leadership of the congressman is really, really an act of patriotism. Because what we do here is important. We can maneuver internally, but when we can mobilize outside and have the benefit of your thinking, that makes it all very special. So thank you for coming. It's my honor to just bring greetings to you, to welcome you here, depart it with Bad Bunny, Ronald Reagan. We're all in it together. Thank you all so much.
Stay with me. Bien, ahora le damos la bienvenida para hacer un anuncio súper importante a nuestro líder. We want to welcome, he's going to make a special announcement, a un gran líder nacional de origen mexicano, a great Mexican-American, Henry Muñoz. Thank you, Henry.
Well, since I came today to just speak from my heart, I'm going to begin by telling Speaker Pelosi that I love her. I love her for many reasons, but one thing that we should all know, that exhibit and those objects that you walked past this morning on the way into this room that will be housed in the National Museum of the American Latino, none of that would have happened without the leadership, the vision, and the strength of Nancy Pelosi so many years ago and over the decades, and we all owe her thanks. Let me just say, I will miss you here, but your legacy will never disappear from the National Mall in the National Museum of the American Latino. I actually came to do something today that I've never done, which is to introduce a man who's been my partner in activism and philanthropy and business for a long time now. To tell you the truth, I'm not Dominican, I'm a Mexican from Texas. And about a decade ago, I was thinking, I'm not sure that I understood anything about the Dominican community, its history, or its people. For a person who spent his entire adult life trying to understand the history and the impact of Latinos on this country, and our imprint on the future of this country, it just wasn't right. Building a museum, building a Latino empowerment program, or creating scholarships for dreamers. And then you know how something happens. You meet somebody and everything changes. Well, that destiny happened to me. I had agreed to go to work with the president, not this president, Barack Obama. And this young man who I trusted very much, he said, you have to meet this guy named Ramon Tayaj. He said he's going to help you to accomplish what you see, a movement of political empowerment for future generations. And you are going to help him accomplish what he wants, a healthcare movement of transformation and of change. So I invited Ramon to sit at a table with President Obama to talk about the rollout of the Affordable Care Act. And most people, when they're in the room with the President of the United States, they're kind of scared to even talk, but not Ramon. And you know, it's definitely difficult to tell the president the truth or that you think he's wrong, but not Ramon. As I learned, because I never forgot him, and I guarantee you the president never forgot him either. He has the ability to speak truth to power on behalf of all of you all. That day he was right. He was right. And a few weeks later, my sister, who helped me run my business in Texas, told me that she was putting me on a plane to go visit Ramon. She said, this man is trying to tell you something. It's important. And I said, I know, Emily, but I don't understand him in English or in Spanish. She was right. He was trying to tell me about the fundamental flaws in our healthcare system. A system built on illness and money and not on people. His vision of a better life for the nameless people who I met sitting in waiting rooms across the city of New York for our nation was so incredibly powerful that at my advanced age, I left everything behind to join his movement. I've never regretted it. Every so often still, I may have to ask him to slow down when he tells me something, but I never have a problem understanding what he sees for all of us. He's a good partner, he's a wonderful father, he's an important philanthropist, and he's the kind of friend who is always, always there for you, incredibly loyal. In other words, Ramon Tayaj is a great man. Now, Ramon doesn't need any more awards and no recognition. He needs to stand in a room like this to share this journey with leaders like yourselves. People who understand that being a leader and a change maker is very hard. Most days, it just sucks. But every once in a while, it's magic. And today, he brings that story to all of us in the halls of power. So it's actually my honor to introduce all of you all to Dr. Ramon Tayaj.
One second, Henry, you can go. Is Adriana here? Adriana, give me a favor for you before I start. I brought this mask for you. Normally, we protect from the virus with a mask. This is to protect from the new virus in town, ICE. It's killing us. Thank you, Henry, and thank you, Adriano. You have been a good friend and an important voice for the Dominican community. And today you make Washington feel like a little bit more like home for all of us, and for those of us who will walk this hall long after we're gone. And I hope that includes in the future, the first Dominican American president. But today I ask myself, what am I doing here? As some of the Dominican, an immigrant to this country, a citizen, at one of the darkest moments in our history, when so many like us are under attack because the way we look, or because we look for a brighter future, like any one of those ones who's pursuing us today came before us. And I thought to myself, what should I say to all of you today about our path forward, about healthcare, which I believe is about opportunity. I'm just a doctor. I wonder how can I make my voice heard in policy. I could notice my English still not good after 38 years in this country. And I like that, to be underdog, because the way I speak. And then I remember that healthcare isn't just a building, or money, or insurance, or dialysis center. It's people. It's always people. Working in the street during COVID, it was about people. When people can afford food, people. When someone can pay their rent, people, human. When someone had to have their leg amputated because diabetes is not a referral, it's people, it's family. Let me tell you what I see. I see a mother who lives in the Bronx, who works 2 jobs, because she has to. One during the day, one during the night. She has no choice. She has kids. They need food. She has parents who need prescriptions. She always put them before herself. She's proud. She's hardworking. She never complains. But one day she wake up in the Bronx, she's dizzy. But she keep going. A week later, she has a chest pain. And she keep going. Another week, another chest pain. Until one day, her body makes the decision to stop for her. You see, she has always been afraid, intimidated by hospitals, or a system that she doesn't understand. One that tell her she doesn't belong. Care that she can't afford. A world where she can't even open the door. She has no idea. Until it's too late. Now she's lying in the emergency room. That's the system. She's told that she has diabetes. It's out of control. Her blood pressure is to the roof. Her life is now at risk. I'm asking you, why? Why? That's the system that we have. Now she has become part of the system that she doesn't even understand. As servants, we see her every day. She's the story of millions of us, the unseen, the invisible, the Latinos, the Dominicans, people who just need someone who speaks the language, someone who listens, someone to trust, someone who cares. Not the politics all around, the everyday fight, no. The woman work. She was delayed for care. She doesn't know what to do. She just needs somebody who she could trust. This is about health care today. She needs wellness and preventative care. Did anybody have any idea of what I'm saying? Have you seen anybody like that? Or yourself, or your father, or your mother? Well, because in this country of greatness, we have the world's best, the best disease sick care of the world. If you have to be sick, we have the best hospital, without a doubt. But that's not health care. That's a system that keeps us in a cycle of illness. "11 years ago, when I stole Henry from President Obama, together with a group of independent doctors, decide to try to change this. To look at the most advanced hospital in the world, the most sophisticated technology around us where we live, just out of our reach. We decide to confront this broken system the way we see it, a system to forget our people, a system that prioritize money, calls, billing, referrals, centers, dialysis, surgeries. A system that forgot our people, doesn't understand our culture, doesn't speak our language, but is in our community. A system that doesn't understand our fears, our poverty, our financial hardships. Then I decide, long ago, as a young boy, growing up in Santiago de los Caballeros, like Adriano, I lost my cousin, Luisa, with leukemia. And I decided to become a doctor, seeing my father and my uncle being in the same field. My uncle, who was a hero in Dominican Republic fighting against Trujillo, who one day was a communist, and the next day he was in charge of the Catholic Church meetings. Then I decided to fight, so that no Dominican family will ever have to watch their child slip away. When I became the Undersecretary of Public Health and Social Service for the Dominican Republic during Balaguer, which at some point it was bad to mention, now I guess some things are changing, I learned how policy shapes people's life and can change their opportunity. So that when I moved to New York to work with the poorest of the poor, the dying, I started working with HIV, AIDS, 20 admissions, 20 deaths, every day. I was preparing for the fight. When I opened my practice in Washington Heights 30 years ago, I didn't know I was starting a movement to transform and change sick care to health care. Today, that movement is known for the people and policymakers. Somos. We are. Somos. We are a network of more than 2,500 doctors, over 900 independent doctors' offices in every borough in New York City. We serve over 1 million lives, humans, people. Some people call them patients. They have Medicaid or Medicare. And you know, we start this movement Let me give you some data that's important to know. We are the largest group of Latinos, the 5th largest group of the country. But we Dominicans in New York are the fastest growing and the largest ethnic group. We are the people of the future. And then say, what do we have done in Somos who could make the difference? Saving life. At the same time, we save money. Where patient is first. We preventative care is what we do. We save 30,000 patients every single day. And the results, I'm going to give it to you because data is important. Some people call cash. No, I believe data is important because when they talk about humans, could change people's life. 35% fewer emergency room visits, 22% fewer hospital admissions, 10% fewer pediatric admissions with healthy children, and diabetes. One of the most prevalent, most marginal disease in our community. It may be chronic, but it doesn't have to be debilitating. Some have reduced amputations and dialysis by 20%. And some politician and some guy in charge of budget in the country, in New York, said to me, you save $400 million this year doing so. I said, what do you think? And I said, yes, Maria Perez doesn't have to wheel the husband every 3 days because he has no legs to get dialysis. That's what it means to me. That's what it means to me. It's not money. It's a change in those people's life and family. So, what does this mean for Dominicans? I mentioned who we are. You know, you should know that hypertension touched 27% of all the adults, Dominican adults. Obesity evolving to diabetes because of the diet, lifestyle, environment, on and on. The number is not theories. What I mentioned to you is human. So I came here today to ask you, what do you want to do? Do we remain con the same situation and keep it like that, don't care about it, accepting that others say that we deserve to be? Or do we design ourselves a new national model of excellence and just equity, where we respect the best health care of the world is in our building, hospital, but create something else outside of that? Give it the power to be sure to keep people healthy and their community to go with their lives and their family. That is why I decided to do what I have always done, to say I am Dominican. I can and I will. Today I will leave an example, Adriano, by announcing a gift that helped move this conversation that we had to into action to transform Dominican on the Hill in the healthcare into the Dominican Opportunity Fund. Over the next 5 years, we're going to have the donation of $500,000 that could match. That could be matched, should be matched for some other groups to get to $1 million, establishing through this gift from the people of Somos, the first national public policy laboratory working on the most pressing issue in our Dominican community, an effort that can determine our future and the future of our nation, but fundamentally changing the design of our system based on communities first with all information, working hand in hand with national policy experts in a hope devoted to strategic change. So that the ideas of this doctor had with me many years ago that you know, you were with me during this pandemic every day in the street. Don't die, don't get lost, don't get forgotten. But instead, they are placing in front of our nation leaders in a new model of advanced value-based care, where we, physicians, nurses, get paid based on results. How do the patients, something that I brought to the DR, and I don't want to talk about that, because my plan was the one who was giving, and you see the results in the news. To ensure that the important foundation of our opportunities, our health is protected. Then when I pass the torch, I have my son with me here, Paul. Could you stand up? To our new generation, I hope that I could say the most important part. Lord Jesus, I have done my job with your blessing. Please, stay behind us all the time, and the future people come behind us. God bless our people. God bless America. Thank you. Somos in Spanish means we are, and we are what we serve.
Dr. Ramon Talaj came to the United States from the Dominican Republic at the request of the Catholic Church to help communities in need. His goal was to make equitable, culturally competent healthcare accessible to the most vulnerable communities throughout New York City. Dr. Talaj created SOMOS, the nonprofit physician network of 2,500 healthcare providers, addressing the social needs of patients and building trust. SOMOS has empowered people to take control of their own health through preventative.
Dominicanos en el Capitolio, en vivo por TV Quisqueya.